Hello, everyone. Welcome to the Black Med Connect podcast, affectionately known as the BMed podcast, where we share inspiring stories of Black physicians and physicians in training. I'm so excited to share this episode with you all. We had the pleasure of having Dr. Robert Gause Wills on from SIU School of Medicine. He was an amazing guest who shared all about his journey to medicine. He shared about his experiences as a patient and his experiences as a upcoming trainee pursuing med psych. So if you're interested in learning more about how his journey has gone and how HIV impacts the Black community, then you should listen to this episode. All right, let's get started. I am so excited because I have a dear friend on with me today. His name is Dr. Robert Gause Wills. We know each other. We go way, way back. Ain't that right?
way back.
way back to college days. Exactly. A decade. Oh my gosh, that's crazy to say. So you could call me Jasmine if you don't mind. I will call you Robert just so we can go with the flow here. But tell me a little bit about your journey to medicine and your background. I'd love to let the audience know a little bit about you.
Yes. Well, again, my name is Dr. Robert Alonzo Gause Wills, and I'm originally from Lansing, Michigan, actually. And I will be starting as a PGY1 in June as a med psych resident. And for those who are not as familiar, it is a residency in which you double specialize. And so I'll be specializing in internal medicine and psychiatry. So I'm really looking forward to that. Oh, yeah.
Awesome. So I know a lot of audience members may not even know that you can do a double specialty, right? So what kind of drove you to do both medicine and psych? And I mean, even early on, before you even got into med school, like where were your interests and how has that changed over the course of your medical school career?
Yeah, well, when I was young, let's start there, So I was a nerd in my family, I'm a preacher's kid, right? So the rest of my family, they are these athletes and teachers and all these amazing leaders in the community. And then my mom had me, a nerd. Right. So I found this interest in science very early. She would take me to the library. We had this really amazing science center called the Impression 5 Museum. And so I would hang out in the different what do you want to call those? Different pieces and different things they had within the museum itself that associated with medicine. And that's what I wanted to do. But here's the issue, Jasmine. When I first got to Lansing with me and my mom, before my father and my mom got married, we were looked at as not being viable in our community in a lot of ways. And so we were treated as if we were othered. And so part of my reasoning to want to be a doctor was to show them and be like, yeah, I could be a doctor. And of course, for everyone out there, this is the bad way. This is not the way you want to go to get into medicine, But this was pretty much my background. And so when I got into college, I had also a conflicting issue. I wanted to be a doctor and I wanted to get far away from my family because I was a closeted gay man. And so I decided, hey, let's try FAMU. They gave me a scholarship, the band and the biology department. So why not? So I originally had TMJ. And for those who don't know, it's temporal mandibular joint disorder. And it stopped me from really being able to play trumpet as well as I would like to, But I was able to suffice,
Could you tell the audience a little bit, what did that do? What were your symptoms for TMJ disorder?
Yeah, so I would have these random muscle spasms within my jawbone. And so those who play an instrument that requires an embouchure, specifically more so brass players, it requires us to flex our muscles within our jaws in a specific way. And so when you're not able to control that, like you do when you have TMJ, it can be very hard to be a musician. So this is where I wanted to go into medicine. I wanted to do performing arts medicine, which focused on diseases and other diagnoses regarding those who in the performing arts sector. So dancers dealing with specific type of injuries, pianists and other brass and woodwind musicians. So that's where I was going to go.
I would be remiss if I don't shout out the Marching 100. You can't have two Marching 100 members on a podcast episode without saying shout out to FAMU and the Marching 100, which is near dear to both of us. And
Yes,
so,
ma'am.
I think it's interesting that you were considering performance medicine. I'm not sure that a lot of people know that that's even a specialty you can pursue. And so it's interesting that you even were going to go down that route. So I'd love to hear more. Tell me more about how you kind of navigated from that into what you're doing now.
Yes. And so Weill Cornell and a lot of other colleges were focusing on a specific type of physiatry, you could say. So it was kind of an offshoot from that. And so it was performing arts medicine. And with a lot of these medical schools and medical colleges, you would be able to simultaneously work on your medical degree and also work in a specific clinic dealing with performing artists. So for example, Weill Cornell, which is where I was looking at originally, you would be able to work with a lot of the students from Juilliard and a lot of the Alvin Ailey Dance Company. I think that's what it was called, but the New York Dance Company, excuse me. So I was just so excited to do that, also being a musician as well. Again, shout out to the Marching 100. And this is my trajectory. This was around the time that me and Jasmine were studying out there, you guys. And so we were studying for the MCAT and did not go too well. For me, it was a little bit above average, but I decided, hey, I'm going to go and try for all of these high performing schools and all these schools with a lot of reputation and tenure. And safe to say, they did not take me, which is okay. So the next 2 years I worked. There was a time where I was also homeless as well,
Oh, wow.
which I don't like talking about. And
Okay.
yeah, actually, one of my freshman brothers took me in.
Okay.
It was a very long story.
Mhm.
I ended up working in our local tutoring center at FAMU, and I ran across this pre-med program at Southern Illinois University. Originally, I applied to their med school, and they got me confused with another guy whose name was Robert Wills.
Wow, really? That's terrible.
Right. So, big honest mistake. So I ended up starting the post-bac program there. And 2 years went off without a hitch. I got into SIU and I'm ready to start my med school career. So at this point, I still have this underlying idea that I want to be a doctor to show those people back at home that I am worthy, and I am this intelligent individual that you guys thought would not amount to anything. And then something happened. About 2 months before, January 26, 2016, I found out that I was HIV positive. And so, mind you, at this point, I've been out and living as a straight man for about 2 years now. Mm-hmm. And this is why this is all full circle. Again, with Jasmine knowing me so well, it's like she knew me back when I was an undergrad and dating a lot of individuals, and I had to apologize to those individuals. But that's a side story. So, January 26, 2016, I have HIV and it devastated me, to say the least. So I was shocked. I felt like I took the necessary precautions. I made sure to always check with my partner and somehow I still got it. So, I'm trying to get through this part of my life and get ready for med school.
Right. How did you cope with it? What were the ways you were able to cope? Because that's such a tough diagnosis to get. As you said, you were trying to be cautious. How did you cope during that time and get yourself prepared? Because that's so much to deal with. How did you continue to move forward with your dreams of becoming a physician?
Well, honestly, I didn't prepare. At that point, it was right before medical school. And I was like, hey, I'm just going to focus on my diagnosis. Luckily, I had this amazing partner at the time who took care of me. I was starting to show symptoms at this point, which is really odd considering that based on when I was diagnosed, I shouldn't have been showing symptoms, but I was. So, hey. And so from this point, I was still working and trying to save up money for med school and, just trying to make it and deal with my diagnosis, pretend like it wasn't there. So I started med school and it did not go well. I did terrible my first year. And a lot of it was the combined imposter syndrome that a lot of us fear as minority doctors or minority med students, there was also that simultaneous feelings of inadequacy because I am this preacher's kid who has always had this certain idea of perfection and reputation and how that mattered. Also, there's a certain sense of Black masculinity that also played a role in this and how, I felt like I needed to portray a certain specific type of Black man, and that all messed with me, and so from this point, I fell into this really deep depression. It was really, really bad. I wasn't able to concentrate. I isolated myself from the rest of my class. It was terrible. So I failed my first year. Mm-hmm.
It takes so much courage, first of all, to even share your story and to talk about, the challenges you faced. And I think it's important. I'm appreciative that you don't mind sharing this because it's important to help our audience understand that we're whole people dealing with our health and well-being, dealing with our mental health as we go through this journey, dealing with our physical health, and then the stigma that we face, whether it be in your case as an LGBTQ plus member or your HIV status that you've willingly shared with us. I just first want to say thank you for your courage and commend you for moving through. And I'd love to, if you don't mind sharing with us, what pushed you from that state of despair into now triumph? Like, what were the driving forces that helped you move forward?
Well, it was, one of them was actually running into the individual that gave it to me. And so this individual I was actually dating when he gave it to me. And long and the short of it, he told me that he gave it to me because he felt like African Americans were ones that should have this disease. And yeah, and safe to say, it shocked me. I wanted to punch him in the face, but we were in public, which is not a good idea. We don't condone violence on this podcast, y'all. No,
no, we don't. No violence, please.
No. I wanted to report him because it was a felony at the time, but I was scared, And so that was actually the catalyst for me to change. This happened during the summer before I started my M1 year a second time. And so safe to say that I got through my second time around and I was still dealing with my status. And so it took me a while before I actually got to the point where I could actually deal with my status. I went into a further deep depression, especially when we started studying more about HIV. And that's when I figured out I really need to change something. I'm not going to be able to be a good doctor. I'm not going to be able to serve my community as well as, those outside of that if I don't come at it from a more healthy, more balanced space. We're dealing with other people's lives. And so if we are not fully present when we're doing that, we could miss something. We could get the wrong diagnosis. We could cause more harm than good to a patient. And so I knew this was an issue and I needed to leave med school. So I took a leave of absence. And that was the start of my healing journey, actually.
Wow. Again, recognizing that you needed that leave. I think, again, that takes courage because so many people would try to power through and push through and not take the time to care for themselves. Are you interested in taking a deeper dive with Black Med Connect? Then join our Black Med Connector newsletter. Each week, you'll hear more about our guests and go behind the scenes to get a deeper dive into their careers. You will get the professional productivity word of the week, and you'll get to see and learn more about amazing physicians doing wonderful things in entrepreneurship and innovation. So head on over to BMED Connect, bmedconnect.com/podcast and join the Black Med Connector newsletter. Back to the episode. If you don't mind me asking, just for our audience, very plainly, what is HIV? Let's talk about that for a second.
Yeah. So HIV is the human immunodeficiency virus. And long and short of it, the virus attacks your immune system. Basically, your immune system that is used to combat bacteria and viruses over time. And it prevents it from being able to do that. And so something like the common cold can cause you to be deeply sick, basically. And so specifically the cells that it targets and it infects are called T cells. And so specifically CD4 cells. And so without that, you're not able to mount a true defense against a lot of bacteria, viruses, fungi, and especially ones that are opportunistic. And so when you see people that go from HIV to AIDS, it is because their T cell count has reached below a certain threshold to where now they're getting opportunistic infections. And so that's when you may have seen in the media individuals with a lot of these brown or black spots around their bodies, or you'll see them skinny and emaciated. And we call that Kaposi sarcoma. And so it is what's known as an AIDS-defying illness.
And you mentioned previously that you had symptoms. Would you mind sharing for the general public, like what were the symptoms? And as you know, the symptoms don't always mean that you are HIV positive, but just in your case, what were your symptoms that led you to diagnosis?
Well, actually, I was first diagnosed through a blood test that my mom was ordering for all of us because she wanted to actually get life insurance. So I found out randomly. But then over time, this was around June and July, when I was still getting my care taken care of, I did not seek treatment right away. And so because of that, I started having a lot of flu-like symptoms. I had, it was 2 or 3 flus back to back. And so at this point, my doctor was wondering, okay, why do you keep getting sick? And I was so afraid to tell him and everything. And so when we finally did have that conversation, it made it real. It really did. And so from that standpoint is when I decided to actually start treatment, and I actually started my retroviral therapy. So it was a litany of flus back to back, and it made no sense.
Got it. Would you mind sharing a little bit about treatment and, what that looks like for you? And the reason, again, we're talking very broadly because we know that HIV disproportionately impacts the African American community. And we can talk about that a little bit. But can you share a little bit about what treatment looks like and even what prevention can look like?
Yes. And so treatment is actually extremely easy. And this took a lot of deaths and a lot of those who sacrificed before us before we got it. But it is called heart therapy. And so basically what heart therapy is, the acronym is leaving me right now, and I don't want to move to my notes. But basically it is a triple dose regimen in which you're going to take 3 different medications. And so over time, that's going to bring your viral load down to 0 or undetectable. It's usually a one a day pill. It's something I take every morning with my vitamin very easily. And in fact, they are in development of long-acting HIV drugs that you can take instead of having to take the pill itself. And so that's actually going to be out in the market very soon. So really, it's 1 pill a day. Very simple. You just set it and forget it.
How often do you get your T cell counts checked?
So it really varies. So when you first get diagnosed, you are set up with what's known as the Ryan White program, and they set you up with a care coordinator and a doctor. When I first got diagnosed, I would get checked once a month, and this was for the first 3 months. And this is going to vary based on your infectious disease doctor, but this is generally what they do. So for the first 3 months, it was monthly. And then after that, it was every 3 months, I think for about half a year. And then from there, it was 6 months. And then from there, after I got undetectable, it was once a year. And so ever since then, this has been a once a year thing. So it's not too bad.
Yeah, absolutely. And I keep bringing up, it's important for individuals to know what this looks like, what the process looks like. How do you navigate your diagnosis? What advice would you give to individuals in general about obtaining their status and STI prevention or sexually transmitted infection prevention? Like, do you have any advice as a future medicine psychiatry doctor resident coming soon?
Number one, don't be afraid to talk about your sexual history with your doctor. It's something that even us as providers still struggle with, because sex and sexuality is still a moralistic thing as opposed to it being part of healthcare and overall health in general, And so that's one thing that if you have a PCP or a primary care provider, please make sure that you talk about that and have him know what your sexual history is. Number one. Number two, if you are sexually active, whether that's 1, 2, 5 partners, that's beside the point. You always want to get tested at least once a month. There are a lot of resources that are within various communities all over. Usually the health department will do it for free. Usually there are other community resources or community partners that can also do HIV and STI testing like we have here. We have the Springfield Phoenix Center, which does free HIV and STI testing. We have the Urban League. And like I said earlier, we have HSS. So please reach out to those individuals and, get tested once a month. It's very quick. It takes about 20 minutes and a very small prick of blood.
Absolutely. Even as a pediatrician, we ask our adolescents about their sexual history as well, because we want to make sure that we are catching things and testing and making sure people have a safe place to have conversations about their relational health. So it's not just about the diagnosis, about your emotional well-being, your relational health, and your physical health when you think about why a physician is important. So this is even a plug for individuals who may or may not go to a primary care physician or provider each year. It's really important to do that. And it's really important to know your status, as, we've kind of talked about some. Now, I'm going to change gears a little bit, unless you have anything to add to that.
Oh, no, not at all. I think that is the most important aspects of testing. I do want to also put in a unshameless plug for PrEP as well. It is the godsend for the healthcare community, honestly. And so what PrEP is pre-exposure prophylaxis. So PrEP. What is that? And so basically it is a drug that someone who is HIV negative can take every day, and it will protect them about 99.9% of the time from actually contracting the virus. It's something that you can also get through your PCP. You can also get set up with a lot of online resources like Gilead. You can also get through them. You can also get it through HHS. And fun fact, most insurances cover it, including public insurance like Medicare and Medicaid.
Excellent. So that means there's an opportunity for everyone to protect themselves by using PrEP. And it's such, like you said, it's such a great tool that now we have as providers to share with our patients, to keep them protected and keep them safe as best we can. And so let's jump back in a little bit to your journey. We left off at,
right.
You took a leave. No, I mean, this is great. It's important to kind of navigate and understand. So you left off at returning to your M1 year. And I wanted to ask what was different about from the first time to the second time. What made the second time around more successful for you?
There was a certain sense of confidence, and I also divulged my issues with the faculty, specifically our dean of students at the time, Dr. Constance. Shout out to Dr. Constance. He took me aside and he actually said, "Hey, Rob, you should take your M1 year off." And this was in the middle of the first time I actually did my M1 year. And of course, we do this machismo thing where we're like, oh, I gotta get through. At the time, I was the only Black man in my medical school class. And so because of pride and ego, I thought I would stick in there. So the second time, I spent that summer and I really prepped mentally. I actually started seeing a therapist, and it really helped me get through. It really did. But we came to an issue my M2 year when we actually started looking into infectious disease and understanding immunology. You look at a lot of textbooks, you look at the way that HIV is still talked about. It is still seen as a quote unquote Black disease, which is sad still. And because of that, we within the healthcare community a lot of times can portray it as, in pictures as, Black individuals with Kaposi sarcoma and PCP pneumonia. And there's that kind of lack of diversity. And that really started messing with me my second year. And so I decided to go ahead and take the second half of my second year off and really stop trying to power through, really focus on my health, because at that point I kept getting sick, and it wasn't because I wasn't taking my medications. I was just not taking care of myself. I wasn't eating correctly. I wasn't sleeping. It was just all around my HIV status. And so I decided to take a sabbatical. Best thing I could have done. And so at that point, I actually started taking antidepressants, which is, again, another thing that's really stigmatized still within the provider world, but much better than it used to be. I also started seeing a HIV-specific therapist. and also a lot of internal thinking and internal introspection, and getting a better or having a better relationship with my infectious disease and my family med physician. And so through that time, I reevaluated, okay, why do you even want to be a doctor? Why are you doing all of this? And I remembered how, I looked at my reasoning, it was all negative. It was based on trying to prove something wrong as opposed to it actually helping people, and so through my experience of having to see my infectious disease doctor, who at the same time is also my professor and my teacher. So I'm seeing my infectious disease doctor and then sneaking out the back, to get away from a lot of my classmates so they wouldn't see me, And so you really get a unique perspective of being a provider and a patient all in one. And I think a lot of times us as providers and as scientists, we forget that we are dealing with humanity. We're not dealing with statistics and this really cool diagnosis that I want to bring everybody in to look at. We are dealing with people who have lives and experiences.
Oh, I was just going to say we're dealing with people and we are people. I keep bringing our humanity back into it because I think sometimes it's kind of misconstrued that we're not robots. We have emotions and feelings and needs, and the same things that weigh on everyone weigh on us. And so, that I remember for my own self, when I was in a car accident in med school, I remember when I rolled into the ED through the ambulance, I remember thinking, oh, am I going to see a classmate? And at one point, the surgeon who came down to the trauma room just to do the, quick assessment was actually my attending. So, he said to me, what are you doing here on the table, as a joke. And I'm grateful that I was awake and alert and could joke back with them. But, it's one of those things. It's very real when you are in the medical setting, but you also have to handle your own health care. So that really resonated with me when you said, you had to go in one direction, trying to ensure that you had your own privacy with your health care.
Yes, ma'am. I'm so glad that you're okay. I did not know that. So I'm glad you're doing well.
Yes. Luckily, it wasn't severe, but it was very distressing. But, got through that and kept it moving.
Yes, ma'am. And it's so true. They tell you this at the beginning of med school. Oh, you may go through some things and that's going to be a part of your medical journey. And all of us are like, oh, no, it's going to be that person over there in the third row. And then it becomes you.
Exactly.
But it becomes your story, though, and it really helps you in your journey of medicine. And that's what it was for me. The work and the time that I spent with my therapist, with my psychiatrist, and with my infectious disease doctor, I saw how it was important that not only my physical health was taken care of, but also my mental health. And also being an African-American male, because I always like to make sure that that is something that's salient and people talk about, because there's still this thing in which HIV and those of us who have HIV and who are Black and queer or LGBTQ plus community, whatever you want to say, there's this tendency to separate the two. So you can't be Black and also be part of the queer community. And a lot of times you'll hear people talk about it as such. And it's like, no, I'm Black, I'm gay, and I'm HIV positive all at the same time. Mm-hmm. Even on a Tuesday.
So embracing you. Yeah, embracing yourself for you in fullness. Absolutely.
Mm-hmm. Exactly. And so from there, I reassessed what I wanted to do in medicine and why I was doing medicine, and understanding truly the need for it, my specific experience. You look at the statistics, you see that us as African Americans are disproportionately affected by not only HIV, but also other STIs, And it's not because we are more promiscuous, quote unquote, than others, because neither one of these diseases are moral diseases. That's also something I want people to remember. This is no different than diabetes, heart disease, But I digress. In fact, you'll see that if you actually look at the data, those within African American communities and those who are not have the same amount of sexual activity rates. So that's not even a thing. But again, that's something that I had to push past. Dealing with my disease, I really found, oh, wow, I wouldn't have been able to deal with this if I did not deal with both the mental and the physical aspect. And the fact that a lot of times as an internist or as a family med doctor, you're not going to get as much of that psychiatry background and training and residency, and vice versa with psychiatry, but they are inextricably linked to me. And so I said, okay, I'm doing MedPsych. And so that's really how I got here.
Absolutely. Because they're so linked together. Our mental and physical health are so linked, but I feel like the need for the double specialty that you're doing is so great. We've talked a little bit about from a kind of the internal medicine aspect, but the mental health aspect too, and the need for providers who care deeply for the community and allowing people to help them work through the obstacles and challenges that they're facing in life. We just need so many more providers who are focusing also on mental health. We hope you enjoyed this episode with Dr. Robert Gause Wills. He shared a lot about his journey through medicine, his own personal healthcare journey, and what he's looking forward to. In part 2, we'll learn all about what he's doing next and some of his interests through the bolus round. Don't forget to like, share, and subscribe to the Black Med Connect YouTube channel and to subscribe anywhere where you like listening to your podcasts. Until next time, always remember to dream without limits. Bye.